Good afternoon and welcome to UBC Lunchtime News. You are watching UBC Lunchtime News from the Nile Avenue. My name is Sharon. Kyomugisha. In our top stories of the day, vetting of recently appointed ministers has been concluded. State Minister for Housing Persis Namuganza expresses readiness to address the housing both in rural and urban areas. Her determination was similarly shared by other vetted ministerial nominees, who also included General David Mohozi of Internal Affairs.
I wouldn't want to start from a point of pessimism. Lots of things have been done, but we can do better, especially in areas of effective policing. I think we are still below the ratios, universal ratios of policing. Issues of image, yes, image. Issues of motivation.
Of course, this is a sector which has been given very, very minimum attention by the government. Right now, we have the deficit of 2.1 million houses. That's a very, very huge gap, which we need to cover up. Talk about the lack of institutional houses, like for teachers, health workers. Like in this particular period of COVID, we would have had our health workers quarantined where these medical facilities are, if they were those health workers' houses.
It's not that you dream a district should be and it becomes. Baseline studies are made, the committees go and visit and establish. By the time Parliament rules and decides there should be a district, it means there is a need. And it is the mandate of government to take services nearer to the people. So it's not haphazard that districts simply come up.
This is an assignment. The other one was more of humanitarian work. I have now been deployed to handle development proper. So I'm happy to move on. I'm very happy to move on.
Nenda kukolera abantu ba Uganda bonna nga sisosola. Kugambye ne bali bangambye sisosola. Saagala kusosola. Bonna abantu ba Uganda bonna mbaagala, bonna balungi, bonna baagala emirembe, bonna baagala okukulaakulana. N'olwekyo nze kuweereza njakuleete ekyokulabirako ekitabaddeewo eri bannayuganda bonna.
I am indeed challenged, but I know the God who appointed me is the one going to lead me through. And I know the God who I serve is always a just one and is a parent. So he will lead me through it, and we shall excel, I tell you.
Well, congratulations to all the new ministers. In more stories, the Minister of Health designate Jen Roth Acheng has said that 175,200 AstraZeneca doses from the COVAX facility is a timely intervention since the country had run out of vaccines. At least 869,915 people have been vaccinated of the 90.2% of the vaccines already received.
Minister of Health designate Jen Roth Acheng has said that a person does not need to be tested before having the vaccine because it has no effect. She says that the vaccine does not prevent anyone from getting COVID-19, but it helps to prevent severe disease and being hospitalized. Dr. Acheng was receiving the 175,200 doses of AstraZeneca vaccine at Entebbe Airport.
We are in a state that needs all hands to come together to address the pandemic. How did we get here? Ugandans were not listening when we were saying we have variants in the country. And the variants give you 2 months as it is spreading. Thereafter, the result is what we are seeing. No amount of oxygen, no amount of vaccines, no increasing ICU beds will get us out of this situation. As others have said before, the best vaccine is ourselves. We need to be responsible people and implement the standard operating procedures.
In the second phase of vaccination, priority will be given to health workers not yet vaccinated, teachers, people with comorbidities, and those due for their second dose.
We are expecting about 688,000 doses very soon. So it is only important that we start and continue as the doses keep on flowing in. And we don't lose track of the priority populations that need to be vaccinated. Our vaccination program this time round will run in the form of campaigns, because what we witnessed over the 6 months that we had the vaccines was the hesitation of people, and yet they wanted to get vaccinated. People want the vaccines to be taken to them, but we are appealing to them to come where the vaccination teams will be.
The French ambassador to Uganda said that so far, 129 countries have received more than 81.3 million doses of the vaccine from the COVAX facility.
We need to be very clear. It is just the beginning. We know that it is not this quantity that of vaccine that will solve all the situation. It is the beginning. We are committed on this. We'll continue providing vaccines for Uganda and all the African continent first. And beyond vaccination, we are also very committed to work on how to provide this country oxygen, unity to produce oxygen. We are also available to provide masks, to provide tests, etc.
The UNICEF representative in Uganda said the second shipment of the 175,200 doses from the COVAX facility is an addition to the first doses that Uganda received in June of 864,000 doses of vaccines from the facility that were followed by the 100,000 doses as a donation from India.
These are very good news for the people of Uganda, that vaccines are coming in and they will keep coming in. But there is another vaccine that is available in the hands of every citizen already. Follow the standard operational procedure to protect yourself. The vaccines are important, but the SOPs are equally important at the moment, and this is the vaccine every one of us has in hand. I congratulate the government of Uganda for the continuous effort to make vaccines available. I also appreciate and thank the government of France and the people of France for their collaboration through COVAX and through the G7 and the EU as well. And I would like to encourage everyone to follow the SOPs and take the vaccines whenever your turn has come.
In more stories, Ugandan medical experts are yet to approve helmet like non-invasive ventilation as a protection against COVID-19 infection. The balloon-like ventilators that can help critically ill patients at ICUs get enough oxygen while preventing the spread of infection. The head of Lung Institute, Dr. Bruce Chirenga, says they have just imported the device and are yet to test its efficacy, then advise government on the way forward.
Coronavirus can cause severe respiratory infections, inflame the lining of the lungs and the air sacs at the bottom of the lungs. And once the air sacs don't work, less oxygen is pumped into the bloodstream, thus no carbon dioxide is removed from the body. Medical experts note that once COVID-19 patients reach this stage, they will need machines to push oxygen into their body.
Greater than 20 liters of oxygen per minute, meaning that we can no longer support them using simple oxygen devices, the ones you've seen, the mask, the nasal prongs. Now they need additional support. This air you see here has a lot of weight. I don't know whether you realize it. When you are normal, you move it in and out. You fall sick, you will see. This air becomes too heavy for you to move. And that's what we call the work of breathing. So because these people's lungs are weak, now they can no longer pull this heavy air into their lungs and out. So now we start to support them. We give them oxygen, but now we give them support using pressure from a machine to move this air into them. This is what we call positive airway pressure. What people maybe have heard is CPAP. Now, when people fail on that, then we need to put a tube down their lungs, relax them, what people call knocking them down, and now a machine breathes for them. And that's what we call a ventilator.
Therefore, medics want to manage well and care for critically ill patients at ICU. Dr. Bruce Kirenga and a team of other medical experts have imported helmet non-invasive ventilation that is to go through efficacy test. The helmet non-invasive ventilation is an alternative for management of acute hypoxemic respiratory failure in COVID-19 patients.
This is new technology. It has just arrived and we are going to test it. Probably on about 20 patients, and then we'll advise the country to see. So these are the things which we are using to treat people who have critical COVID. It's going to be a game changer. Just sit there and you are getting your oxygen, you are getting your pressure. You've seen it has even where you can put a straw, you can drink water, you can open it up. That will be so that is COVID.
The helmet, the device, is made of a lightweight transparent plastic that looks like a spacesuit hood. It seals tightly at the neck with two tubes which supply oxygen while removing carbon dioxide.
It's simple. This is a helmet for delivering oxygen. You can call it a hood. It looks like a helmet. This actually just came. Even my colleagues coming here, we are going to set it up. We just imported it. It's called a helmet. If you have seen people in ICU, we put a mask on their face, and the mask covers them. It is a bit uncomfortable. So we think using this, by putting it completely on your head, we can now give you that pressure I'm talking about. We can also give you oxygen. For us, we just put now the oxygen here when it is on your head. We think this is going to be more comfortable and may prevent people from going on to a ventilator.
Dr. Kirenga notes that they will use these helmets for ICU patients who display symptoms from low oxygenation levels due to COVID-19 and hopes that the device will stabilize the patient's clinical condition and allow for more rapid improvement. Zahara Abigaba, UBC.
Moving on from that, members of parliament have joined the campaign to sensitize the public on the deadly coronavirus that has claimed many lives. Members of parliament from different constituencies are now giving different COVID-19 preventive messages to the population.
I know Masaka Regional, Sembabule, we normally take the patients to Masaka Regional Referral Hospital, but I don't want you to get there. Please make sure you prevent yourselves from getting this funny disease. As we say in Uganda, that okugema kusinga okuwonya. Please insist so much on diet. We have the fruits, we have jackfruit, we have the watermelons, we have the pineapples. Please concentrate on feeding. We have our beans. Make sure we feed our children, we feed them on time, and we make sure that we follow the diet. Much as these days we have financial constraints, but do your best to ensure that the immunity of our children is seriously boosted. I know we shall overcome.
But one thing I would advise my people of Soroti City is that there is no hospital, there is no doctor who is going to cure you from this disease. The best thing you can do is to prevent yourself from getting it. Stay home, keep social distance, always wear your mask. It is us. The challenge is on us, we the people who are still alive, to ensure that we follow the precautions that were put in by the Ministry of Health, because it's only in that way that we can fight COVID-19.
Well, we'll take a short commercial break and we'll be back with more news.
Owaitabu, tunamaliriza. And what are you doing throwing papers all over the place?
I'm looking for an invoice for a sound system and cables that I received yesterday, but I can't find it.
You know there is a way of keeping all this in one place and available to you as and when you need it.
I really wish there was one, because the way these invoices grow legs and disappear.
I believe this is what you're looking for.
Now how did it get there?
Tabo! Do you know that with EFRIS, you can stay on track of all your business transactions and improve on your record keeping?
How so?
Katituliku computer with EFRIS. I just search using the fiscal document number and I retrieve the records I'm looking for. Bookkeeping becomes simple after that.
Kapo, awesome, yeah.
I began using URS Kakasa Solutions and now I'm in charge of my business. And you can as well.
Kakasa, be sure you are in charge of your business.
Uganda Revenue Authority. Developing Uganda together.
Echa COVID-19 chijja kugwa. If we get vaccinated now, observe social distancing, wear masks properly, sanitize or wash our hands with soap and water regularly. Together we can defeat this enemy.
You're still watching UBC Lunchtime News with me, Sharon. Kyomugisha. In more stories, over 400 trucks have remained packed at Mirama Hill at the Uganda-Rwanda border point following a protest by the medical team handling COVID-19 tests for people. Now, the protest by the medical workers followed delays by government to pay their risk allowance since last October and also providing them with protective gears. Trucks from either countries have now remained packed at the border since they do not have COVID-19 medical clearance certificates, a requisite of their movement. Francis Biamukama, the head of the medical team at the border, says they have been working under tough conditions for almost a year now.
Even have 1,000 to buy a bottle of water. This is unfortunate. But we know our president is not in the know. If he had known this, he would come, or he would have come for our rescue. I'm sure, 100% sure, that our president is not aware that health workers at points of entry are not paid. you would have said something. Like orphans, you report, you can't get a feedback. And in communication channels, feedback is very important. If they had told us that maybe you are there, or you shall get whatever it takes, or we are just stuck, then we would be calm. But how do you keep promising someone from November? This is now June. You keep promising someone November, December, January, up to June. Nothing.
Border. Stumanyi lwaki tulinga abatali mu bannansi naba banga tuli mu nansi wano tugende Kenya tetusasula bino ne population tubisasula Kenya tubisasula mu Uganda ne Rwanda e Burundi tibabisasula bino.
Integrated epidemiology, surveillance and public health emergency have assured Ugandans about COVID-19 related mistrust and health impacts. It follows public complaints and doubts about the type of vaccine and their destination, wondering as it's rightful to respond to this cause. The Commissioner, Dr. Alan Murota Nyonzima, assures the public that the vaccines are authentic.
The overwhelming numbers of cumulative cases, deaths and recoveries in the country have caused controversy among the public, leaving them in a medical mistrust in the health sector. The Commissioner, Integrated Epidemiology Surveillance and Public Health Emergency at the Ministry of Health, Dr. Alan Muruta Nyonzima, assures Ugandans that the vaccines are safe. He dispelled fears among the public who doubt that if a person is vaccinated and then gets infected with COVID-19, he or she is more likely to succumb to COVID-19. The doctor advises the public to go for medical checkup instead of banking on self-medication. Uganda has received another batch of vaccine as the public wait for the vaccination exercise to commence. Irene Faith Nantongo, UBC News.
Kampala Capital City Authority and police enforcement have demolished a building constructed at Old Taxi Park land, contrary to KCCA physical planning standards. The demolition is intended to create space for expansion of the park.
KCCA enforcement has demolished a building constructed on the Old Taxi Park land next to where the park lies. This is to help the decongestion of taxis that enter and exit the park. The activity was manned with a bulldozer to ease the enforcers' work. The owners of the building and those operating business were left in suspense, wondering what to do next and where to relocate.
Executive Director Mukyala Kisaka Mama webale nnyo webalire ddala omulimu gw'okoze. Watusiba tugamba abaggaga paaka President Museveni yagituwa.
It was an enjoyable moment for street children as they collected scrap and materials from the demolished structure. KCCA spokesman Daniel Nwe on a phone call confirmed the demolition and warned those who own buildings that are not approved by KCCA fiscal planners in the city.
This morning there was a
a demolition of a structure that was under construction without permission from both the physical planning team as well as from the building control committee under the respective laws of the Physical Planning Act and the Building Control Act. Now, this was after several notices had been served to the client as well as enforcement notices. So the place was put back to its original state when the construction had not commenced. It is our appeal to all in Kampala. We saw a number of structures rise without permission in the previous COVID period. There are those who would want to construct and dodge the control requirements or the permissions required. We appeal to you not to do this because you lose so much of your money.
The demolition comes after KCCA launched a plan to decongest the city, including a ban on commuter taxis operating by the roadsides. Ivan Juko, UBC News.
It's no secret that ICT makes learning easy.
The strides made in our field could not be possible without it.
And now we can watch our favorite show.
My radio is my best friend.
UCC provides an enabling regulatory environment and policy guidance for healthy competition. We also facilitate ease of doing business in the communications sector through licensing, standardization, spectrum management, tariff regulation, rural communication development, and consumer empowerment. An informed consumer is an empowered consumer. UCC supports local content and innovations. Driving the development of a robust communication sector in Uganda is Uganda Communications Commission.
Now, Kenneth Kaunda was one of the pioneer leaders of the new Africa as countries threw off colonialism in favor of independent statehood. A man of great personal charm, he was hailed as a modernizing force in the continent, despite his initial rejection of the concept of multi-party democracy. As a committed Pan-Africanist, he began the task of building a new Zambia, free to determine its own way in international affairs. But poor economic management caused his popularity to plummet, and he was voted out of office when free elections were held in 1991. Kenneth David Kaunda was born on 28 April 1924 at a mission station near the border between what was then northern Rhodesia and the Congo. Well, that's all we had for you for now. Thank you so much for watching UBC Lunchtime News. My name is Sharon. Have a good afternoon and stay tuned for more programming.